Splitting headaches, you reach into your medicine cabinet for some aspirin, only to find the expiration date on the bottle has passed last year. So, do you take it or do you toss it? Today, which expiration dates in your medicines really matter and which ones don't? Here to help is pharmacist Suzy Cohen. So, why do medications have expiration dates?
Well, it's a guide. It's to help us understand when something can become ineffective or dangerous. But it is just a guide. Just because we reach that date doesn't necessarily mean that it's harmful or ineffective. Basically, the manufacturers put this on the product to guarantee 90% potency, at least 90%.
But where do we look on the containers to find those dates?
Well, all medicines will have it. So usually on a tube, you'll see it on the crim. And on something over the counter, it's often on the bottom or the back. And on a prescription medicine, you'll find it at the bottom of the label usually.
Right down the bottom.
Yeah.
So Suzy's got some pharmacist rules for expiration dates for all of us to follow. And I'm going to show you how we're going to do this. Welcome to the show, by the way.
Hello.
So we got two
Thank you.
gas buckets. You're going to be challenged in a limit. Mona, the audience can help you out here.
Okay.
Now, we have a take it or toss it bucket.
Okay.
So, and here we have ibuprofen, oral histamines, and over-the-counter sleep medication, insulin, and nitroglycerin. Lauren is going to figure out where they belong. Have you ever taken medications, be honest now, past their expiration date?
I'm sure I have, like an aspirin. It's not going to kill you if it's a little over the expiration date, right?
We're going to find out.
Okay.
All you got to do is
Okay.
take these products and put them where they belong. I'm going to give you 10 seconds. Again, if they have gone past their expiration date, you take them or you toss them. Ready? Go. What do you think, audience? I will roll fast. She's tossing. She's.
Oh, wait.
Oh, taking, tossing nitro. Oh, insulin, tossing. Yeah.
Take.
Didn't she did it in time? All right. So, I'm going to give you rule number one before she starts talking. Rule number one is life-saving meds get tossed if they pass their expiration date. So, Suzy, help her out.
You did really, really good, first of all. Okay, so I would personally be comfortable taking certain medications, and I'll go through them. Allergy medicine, I would personally be taking that if it had expired, a few months beyond that. Pain medicine, I mean, nothing bad's gonna happen. Maybe it's just slightly less effective. Even a sleep aid, the worst thing is you're up all night.
So you take it?
I would.
Okay.
Something like nitroglycerin, which is used by prescription for heart disease, or insulin, which is used for diabetes, those are life-saving medicines. You want them to work. So for those two, I would say toss them and make sure you have fresh medicine on hand.
Okay, that sounds good.
That was smart. Oh, that was right.
Now, I'll be honest, for me, I would take this, but if it was for my kids, I always check the expiration dates for my children's medicine. Is there any difference between children's medicine and your own?
Yeah, that's a great question because a lot of children have earaches and they take those pink medicines that are antibiotics, and those can go bad after the 14 days. Usually it's 5 to 14 days. You want to toss those. You never want to give your child expired medicine.
But just here's some confidence. There was a U.S. government study where they looked at products that had not been opened. So imagine this bottle never opened and wanted to see how long could it last past its expiration date. Any idea what the number was?
A long time, I'm thinking.
15 years.
Oh my gosh.
15 years. Again, that was unopened. I'm assuming you bought it and used it, so we can't assume that. But I think we actually have a little comfort, at least for a few months.
Yeah, definitely.
Maybe longer.
I think they put it on so you just buy more.
Right.
Is it really going to harm you?
Well,
I just want to rebuy it.
Again, well, I don't know. The solid ones we have a little data on, but let's move on down here. Actually, thank you very much, Lauren. Suzy, come join me.
Yeah.
Let's talk about the second question Lauren asked, which is, is it really only for some things we have to be worried about? Talk about liquid products here. Because you said we should toss the liquid meds.
I would, because liquids inevitably have sweeteners in them and sugar, and sometimes they breed bacteria. Sometimes they're suspensions, and they come apart, and so you don't know if you're getting the medicine portion or the inactive portion. So with liquids, I would just toss them all out at the expiration date.
You also said we should smell it, touch it. I see it as well, I guess.
Yeah, I would. I look, smell, and touch, and you can tell a lot about a medication by doing that. So if you look at aspirin, aspirin is found all by itself as well as in cold medicines, and you can see that it's yellow. So it's discolored, so that's a sign that it's going bad.
It's supposed to be white.
Yes, it's supposed to be white. And then other medications, they come apart.
Oh.
If it crumbles, it's done.
Yeah.
And you can see that. And if it has a foul-smelling odor, sometimes it's like vinegar, but it could smell just strange to you. You want to take a whiff?
I already smelled something really bad today.
All right, then you can take one more.
It's relatively reviving after that urine smell I had before.
Oh, well, this isn't bad, it's vinegar. So if it has that kind of an odor to it, then you want to toss it. Obviously, that's a sign that it's disintegrating.
Yeah, and the fourth rule you have is we have to toss meds in food form.
Yes, we're seeing a lot of this. So we're seeing foods in gummies and in chews and chocolates and things like that. So with food, you never want to take bad food, right? I don't care about the active ingredient in this as much as I care about the actual food, because you don't want to poison yourself or something goes bad and get rotten food. So forget the active ingredient in the foods. If the food goes bad, and follow the expiration date, get rid of it.
And one thing that you also point out is that how we store the medication makes a big difference.
Big difference.
For example, you put them on one of these caddies, and they're sitting around there. It's not the original container. That can make a difference. If it's in a cool, dry place, it'll last longer. If you want to really maximize your ability to take advantage of medications, even a little bit past their expiration date, if they're the solid, non-threatening brand that we mentioned earlier.
Yeah, definitely.
Right?
No longer than a month in these, because it's exposed to oxygen and humidity, so things will go bad faster in this. So no longer than 30 days. And I don't want to hear of anybody putting medicines in their pockets or wallets or purses. That will make it expire much faster.
Thank you very much, Suzy.
Thank you.
We'll be right back.